Hello friends, welcome back to Braces and Bones. Today I want to discuss with you a very commonly occurring dental problem, that is trauma to the front or the anterior teeth. Before you think of skipping or forwarding this video, do remember while going through so much of literature, there's one thing that I realized, and that is the public awareness on how to deal with a dental trauma, how to deal when there's a blow to your teeth. It's very poor. So, listen to the video till the end. Take one or two tips, whatever you find useful. Keep it at the back of your mind because, unfortunately, a trauma to the teeth can happen to anybody at any age. Let's first see the three most common reasons why a dental trauma to the anterior tooth can take place. First and foremost, road traffic accidents. Now, road traffic accidents generally happen either in young adults or in adults. Number two is physical fights. Like injuries during physical fights can generally happen in wrestlers. And number three is sporting injuries. Now, sporting injuries generally happens in the age group of 7 to 12 or 7 to 14 years. Basically, when you see this whole scenario, dental trauma can unfortunately occur in any age group. Now, quickly, let's look into the immediate signs that you need to look out for after a dental trauma has occurred. Number one, bleeding from the socket. When there is bleeding, use an ice pack, put an ice pack over the soft tissues, and immediately rush to your dentist for the further treatment. Number two, look for visible fracture lines on the tooth, or there can be an evidently missing part of the tooth that's been lost. Number three, mobility of the teeth. Mobility of the teeth can be temporary because of the blow on the face, or mobility of the tooth can also happen when there is a fracture in the root area of the tooth. So, in either of the cases, you need to see a dentist. Fourth is displacement of the tooth. Tooth can be displaced inwards, also called intrusion. They can be displaced outwards, also called as extrusion, or there can be a lateral displacement either to the left or to the right side of the tooth. Now, again, trauma can cause displacement of the teeth. Displacement of the teeth can also mean that there has been a fracture in the bone and the bone segments itself has been displaced from its position. Number three, it can again mean a fracture in the root of the tooth, and all of these conditions need to be assessed by a dentist and be treated accordingly. Number five, swelling around the gums of the tooth. Swelling around the gums can either be a soft tissue injury or they can mean that the root portion of the tooth has been fractured and has been displaced to another location. Last but not the least, complete knocking out of the tooth. Now, complete knocking out of the tooth means that the tooth has either fallen on the ground at the site of the trauma or it's in the hand of the patient. Three things that you have to keep in mind when there is a complete knocking out of the tooth from its socket. Number one, there is a chance of reimplanting or replacing the same tooth in its correct position if you get the patient to the dentist in the shortest amount of time, and within 1 hour there is still a chance that the tooth can be reimplanted in the patient. Number two, when you get the tooth to the dentist, try to keep it in a medium which is very safe, and the safe medium for the tooth is either milk or patient's saliva. Do not try to wash the tooth, clean the tooth on your own. Let the dentist do it the way they are supposed to. Number three, whenever you try to pick this tooth up, do not pick it up from the root portion of the tooth. Now, this is crown of the tooth, that is the visible portion of the teeth to us, which is white, and this slightly brownish in color portion is the root portion of the tooth. Root portion has a lot of living cells on it. When you hold these living cells, when you try to clean them away, these cells are washed out, which will reduce the chances of reimplantation of the tooth. So, do not try to hold it from the root, hold it from the crown, place it in a safe medium like milk or saliva of the patient and get it to the dentist at least within 15 to 20 minutes. so that the dentist gets some time to clean the tooth and place it back in position. Because this dental trauma is generally accompanied by a more severe problem like a limb fracture or a head injury during accidents or falls, dental trauma takes up a backseat, and the person generally forgets about these injuries, so they forget to take care of the tooth in the later stage as well. I really hope you found this video useful. Do keep these points in your mind and keep watching the further videos, because I will be discussing on how to reduce the chances of dental trauma in all the age groups. Thank you.